Hello, good afternoon. My name is Tânia Vinagre, and I am responsible for the executive implementation of the Champalimaud Pancreas Programme. The statistics around pancreatic cancer are just appalling and have changed very little, if at all, in the past few decades. We believe there has to be a better way to tackle this problem, and our ambition is to contribute significantly towards improving the lives of patients dealing with pancreatic diseases. With this goal in mind and leveraging the Foundation's core strength of bridging research and clinical care, we have put together a pancreas program with three main arms: a clinical arm that we call the Pancreas Fast Track, an educational arm, and the research arm. Let me go briefly through each of these. The clinical arm, the Champalimaud Pancreas Fast Track, is an extraordinary initiative in which we've streamlined our internal procedures and referral pathways to the extreme in order to be able to offer patients a comprehensive and multidisciplinary assessment of their pancreatic problem within just a week. For this, we have put together an extraordinary team of physicians, and we have a dedicated nurse that is the primary contact for patients throughout their enrollment in the program. The educational arm has two elements. One element is dedicated to or is directed towards patients and their families and includes several informational materials, and will also host sessions for patients to really become part of a community and clear their doubts and their questions with our doctors. The second element of the educational arm is directed towards the scientific and medical communities. In here we'll host several international meetings and conferences, and we will also offer advanced medical education to young physicians looking to further their medical education, particularly in techniques related with the diagnosis and treatment of pancreatic diseases. And finally, the research arm is based on research that is actually being conducted here at the Champalimaud Center for the Unknown. And there are four main research lines related with pancreatic diseases. The first one is immunotherapy, in which the patient's own immune system is directed towards the fight of that patient's specific tumor. In fact, we already have a clinical protocol for those patients that are eligible to go through it. Another research line is Radionics, in which our researchers strive to identify imaging biomarkers from the patient's radiology scans. These imaging biomarkers are useful to improve the early diagnosis of pancreatic diseases and also to help physicians decide between treatment options. One research line that we're very excited about and we think is very promising is spectroscopy. Here, our researchers use very powerful preclinical MRI scanners to try to do the differential diagnosis between pancreatic cysts that have potential to become malignant and those that are perfectly benign. If we succeed in doing this non-invasively, it will be a significant step forward. We also have a group focused on exosome analysis. Exosomes are small vesicles that circulate through the body and have tumor-specific information that can be used for the early diagnosis and also for a personalized therapy. All of these elements come together to create what we hope is an innovative and effective approach to fight pancreatic diseases.